Do you know how to save a child's life in an emergency? What if a child suddenly chokes on a toy or stops breathing? It's terrifying to imagine, but knowing what to do in these situations can make all the difference. Today, we're going to break down the processes of CPR and the Heimlich maneuver into easy-to-follow steps. First, let's tackle CPR. Remember, CPR is a life-saving technique that combines chest compressions and rescue breaths to keep blood and oxygen circulating in the body. It's a crucial skill to have if a child's breathing or heartbeat stops. Step 1. Check the environment. Ensure it's safe for both you and the child. Check for responsiveness by tapping the child gently and calling their name. Step 2. Call for help. If the child is unresponsive, yell for help. If no one is around, dial your country's emergency number yourself. Step 3. Position the child correctly. Lay them flat on their back on a firm surface. For infants, make sure their head is slightly tilted back to open the airway. Step 4. Begin chest compressions. For a child, use one hand. For an infant, use 2 fingers. Press down hard and fast in the center of the chest, aiming for about 2 compressions per second. Step 5. Give rescue breaths. After 30 compressions, give 2 rescue breaths. For a child, pinch their nose shut and cover their mouth with yours, then blow in until you see their chest rise. For an infant, cover both their mouth and nose with your mouth, then give a gentle puff of air. Step 6. Continue the cycle. Keep performing cycles of 30 compressions and 2 breaths until help arrives or the child shows signs of life. Now, onto the Heimlich maneuver, a procedure used to dislodge an object from a choking person's airway. Step 1. Stand or kneel behind the child, depending on their size. Wrap your arms around their waist. Step 2. Make a fist with one hand and place it slightly above the child's navel, but well below the breastbone. Step 3. Grasp your fist with your other hand and give quick upward thrusts. Step 4. For infants, hold them face down on your forearm, support their head, and give 5 back blows between their shoulder blades. Then, turn them over and give 5 chest thrusts. Step 5. Continue these steps until the object is forced out or the child starts breathing or coughing. Remember, these techniques are critical in emergency situations. However, prevention is always the best medicine. Keep small objects out of reach of children and supervise meals to prevent choking. Also consider getting certified in CPR and first aid. It's knowledge that could save a life, so now you have a basic understanding of how to perform CPR and the Heimlich maneuver on a child. Hopefully you'll never have to use these skills, but if you do, you'll be prepared. Stay safe, and thanks for listening.